everybody. Welcome to the Community Opioid Symposium webinar. The session is Trauma-Informed Care, examining trauma's role in opioid misuse among youth and equipping practitioners with TIC techniques to enhance support for youth. Our presenter is Christian Specks. It is 1 hour for today's presentation. This is a free educational event brought to you by Northeast Delta Human Services Authority, Louisiana Department of Health, Office of Behavioral Health, and Foundation for Wellness. It is accredited for 1 hour for AMA PRA Category 1 credits, ADRA, Social Workers General, and LPC's Diagnostics. Neither of our speakers or members of the planning committee have any financial disclosures, and you can find that information as well on our accreditation statement that was emailed to everybody. Full participation of this presentation is required to receive credit, and we monitor throughout the session. 1 week, you'll receive an email from Foundation for Wellness with instructions on how to claim your credit and access your certificates. So a little bit about our speaker before I turn over the floor to her. Profession Christian Specks is an assistant professor of social work at the University of Louisiana Monroe with over 19 years of experience in the field. She holds advanced degrees, including a Master of Philosophy and Education, a Master of Theology, and a Master of Social Work, and a Bachelor of Arts. She is currently a Ph.D. candidate, focusing on P20 special education and an emphasis on neurodivergent students transitioning to post-secondary education. Beyond academia, Professor Specks is the founder of Grace Restored Counseling and Consulting Services, LLC, a faith-based practice supporting individuals, families, and communities with disabilities. Her unique blend of clinical, educational, and spiritual expertise allows her to guide clients through complex circumstances and implement inclusive interventions, therapy, supervision, and consultation. She continues to advance equity and support in both educational and community settings. So thank you so much, Professor Specks, for being here.
Thank you so much for having me. Thank you so much. At this point, I will begin to share my screen so that way we can go forward with the presentation. Thank you again for this wonderful introduction, and I am delighted to be here with you all to discuss this important dialogue concerning the matter relating to the topic that we've presented on multiple occasions. This was offered by the Foundation for Wellness, HSA, Department of Health and Hospitals, Behavioral Health Unit. So whatever settings that or environments that you may work in, live in, play in, you may encounter youth from various walks of life that deals with certain circumstances, or they may have dealt with something in their lives. We have encountered specific patients that could be students, clients, customers, and most of us have worked alongside with others as coworkers, supervisors, and colleagues. So wherever you are, whether you are in the work environment or not, you will run across a person that is likely to have had some type of traumatic experience. So today's experience or webinar will deal with trauma-informed care, examining trauma's role in opioid misuse among youth and equipping practitioners, particularly with TIC techniques and enhancing support for the youth that they serve. Thank you again for coming, and we look forward to this presentation. Now, today, we will discuss our learning objectives. Our first objective will be to explore neurobiopsychosocial factors. We're going to explore those factors and how the intersections between childhood trauma and opioid misuse among youth are apparent. We're going to also determine or examine the statistical data, examine the epidemiological data to see if there's any traits linked with childhood trauma that will increase the susceptibility to opioid misuse and risk among youth. We're going to implement evidence-based interventions. We're going to identify some youth-centered interventions or evidence-based interventions, as well as trauma-informed engaged techniques to enhance support for the youth that are susceptible for or to opioid misuse. And finally, we're going to foster some resiliency by integrating practitioner-centered, evidence-based interventions and trauma-informed strategies. So that way we can foster provider resilience and to understand more of vicarious trauma awareness. Again, before we get started, I want to acknowledge that we're going to be talking about some areas or topics that people may find upsetting. So please feel free to do whatever you need to do to take care of yourself throughout this training. As far as a financial disclosure, I myself have no financial disclosure or conflicts of interest to report during this presentation as well. So as we prepare for our time together, I want you to take a moment just to check your knowledge about some of these things and understandings before we explore evidence-based um, issues pertaining to trauma use, opioid misuse, and things of that nature. So let's explore what your working definition of this complex issue is. If you could use your chat box to define what is trauma, could you take a moment to define what is trauma? Using your chat box, you can take a moment to define what is trauma. You can define also what is opioid use or misuse, and then talk about what the connections between those and dive into a deeper understanding of what that looks like. I see that we have some people that are defining trauma. We have trauma is an event to which individual has little control over what happens to them, but which leaves them in a lasting um, impact on their lives and brains and personality. Absolutely. We also have trauma is an event of life that causes or can cause permanent harm or physical or psychological damages. Absolutely. Trauma is a significant negative occurrence that impacts someone's emotional impact in someone emotionally and psychologically. Yes, absolutely. There are several different definitions that have been provided, and these are some really good opportunities to share some of these things. We have one person that noted that trauma is an experience that has a lasting impact on a person, creating visceral and involuntary reactions. Correct. Trauma also exposures to an incident or an accident or a series of events that are emotionally disturbing or life-threatening with lasting effects. Yes, yes, absolutely. All of those definitions are absolutely correct in their own sense. Trauma, again, is a reaction to different experiences a person has or has affected them. Trauma, again, is a disturbing experience or experiences that can affect a person emotionally. Absolutely. These are some wonderful definitions of trauma and how trauma is defined. Some opioid use definitions could be opioid use of opioid products to alleviate pain. Misuse occurs when the use is not appropriate. That means too much of a substance or too little of a substance that are not prescribed by a medical professional for use by that individual, such as fentanyl, um, trauma, again, is a psychological or emotional response to event. That is awesome. Thank you for providing these excellent definitions of substance abuse, trauma definitions, and substance or opioid misuse. And those are some really good definitions. As we dive a little bit deeper into these actual definitions or key terms to effectively address opioid misuse, specifically among youth through a trauma-informed lens, is we have to have a clear understanding of the foundational concepts that are associated with these, and these are really critical. This section introduces key terms in our discussion throughout this presentation, and it offers us a framework to understand these complex issues. And we are continuously allowing others to just pour in their definitions of opioid misuse and trauma-informed care. So when we think about the terms trauma, these terms are likely familiar, but we're all want to make sure that we're on the same page. So when we hear people talk about trauma, when we hear people talk about toxic stress or adverse childhood experiences, sometimes these terms may be used or may be thought of as interchangeable. But knowing the difference between these terms are especially important for us as caregivers, as providers, as advocates. So when we think about things like childhood adversity, that term is broad and it can range from a series of events that particularly pose a threat to a person's or a child's physical or physiological well-being. And these events may occur in all developmental stages, including prenatal and throughout a child. child's childhood and their adolescent years. If you are familiar with the term ACEs or childhood adverse experiences, again, this was conducted through an ACE study by Dr. Politi in the 1990s, and he conducted research study that has expanded our knowledge and our understanding of this particular topic. So the ACE study specifically gave us insight to some common experiences of early childhood life experiences or adversities, and how some of these experiences can even events attributed to poor risk factors or poor health outcomes and psychosocial health outcomes. And current research endorses the use of these expansive terms in childhood um, and early childhood adverse experiences. So when we think about other terms that we can clearly identify, such as protective factors and risk factors, those protective factors are characteristics or conditions that reduce a buffer or buffer the effects of those adverse stressors or the adverse childhood experiences, or they can promote healthy and well being. And research has really shown that protective factors such as strengthening our economic supports and families and caregivers, so having a supportive work environment, having access to equitable child care, and forming these secure attachments can really help us identify those protective factors. And when we think about the terms resiliency, resilience is a learned ability to recover from and effectively adapt to any traumatic event or an accumulation of adverse experiences. And so resiliency is not just an innate trait, meaning that we were not born with knowing how to adapt to different traumatic experiences or adversity. It just merely means that it is a resource that we're not running out of it. We're just in a relationship that helps us to develop those things and develop those skills. When we look at these childhood adverse experiences, particularly in childhood community events, you can see that these experiences, such as maternal depression, emotional sexual abuse, mental illness, incarceration, homelessness, divorce, even uh, have an experience or have a traumatic event or effect on children and families. So when we look at how these um, studies or how these environments have affected us, and especially looking at the expanded ACE study, this have concluded that there are layers of adversity that we have to, understand that there are impacts on our development, and understanding these have evolved, and we know that from you have understanding what trauma is and understanding the adversity that impacts our larger community as a context, we can understand that these things affect us in a more personal way, but it also can affect us in a more intergenerational level and generational experiences too. And as you can see, as those adverse community environments can help us to understand that, including the poverty, discrimination, poor housing, violence, these things can affect the way we view and the way we communicate as far as how the environment affects our way to deal with those traumatic experiences. When we look at childhood or think about childhood adversity, especially through the lens of looking at our own backyard in Louisiana, we understand, especially with the United Health or United Way Organization of Southern Poverty Law and the National Institute or the National Survey for Children's Health, we can see in Louisiana specifically, 51% of children living in households below the ALICE threshold, with 19% living under the federal poverty line. That is some astounding numbers when it comes down to understanding our economic hardship. It also says from the Southern Poverty Law Center in 2021 that 1 in 7 persons deal with parental incarceration. And then 71% of individuals experience, especially children within a witness domestic violence in their homes, according to the National Surveys of Children. These statistics are really prevalent to help us understand that childhood adverse experiences, especially in Louisiana, are prevalent and are important to understand how we deal with these. Now, specifically going back to trauma and the definition that you provided in your chat box, trauma is a term that is something that we used to get it confused or misaligned with adversity, but we know all adverse experiences are traumatic. But trauma is actually how the body experiences an event or series of events that interrupts or inhibits a development of a person's sense of safety, agency, dignity, and or belonging. And trauma can be caused by many different types of adversities. As we can see in Louisiana alone, economic hardship, parental incarceration, domestic violence are just three of those complexities that may contribute or attributed to trauma. In addition to the definition that I just provided, according to the social work definition, trauma is defined as an injury to the person's or body or psyche by some shock, violence, or unanticipated situation. Some of those symptoms could include feelings of withdrawal, helplessness, depression, anxiety, and fear. And as we look at further down our presentation, we have the National Child Traumatic Stress Network defines trauma as well as an event of a frightening or violent incident that endangers a child's life or physical integrity, and that's considered a traumatic event as well. And it can also be stressful to see how these traumatic incidents occur that specifically put a loved one's life in danger, whether it's physical danger, emotional danger, uh, mental danger, and making sure that their safety is in jeopardy. So we have to just understand how trauma affects our world, our children, our youth specifically, and their perception of safety is based on how secure they feel and if they believe that those attachments can be especially crucial. These experiences that we may have had that manifest in the forms of trauma can often, again, impact our perception of safety. And again, we talked about some of those ACEs and how they're connected with trauma and how those traumatic experiences are included. That it, again, includes abuse and neglect, witnessing violence that could be domestic violence, physical violence, witnessing natural disasters, including homelessness, the loss of a loved one, or intrusive or chronic medical conditions or medical treatment that a person is undergoing. Substance abuse within the home or substance abuse, within the person that's dealing with it, and our bullying can be considered traumatic experiences for those who are undergoing this experience. The next thing that we want to highlight is understanding the neurobiophysical factors that impacts adolescents specifically or a youth. And when we understand what an adolescent is or what the stages of adolescent is, our text, especially within the context of the human behavior in the social environment context from a social work lens, they identify adolescents as early, middle, and late hood phases. So the early stages of adolescence could include ages 11 to 14. And this is where abstract thinking begins. This is where there is an increase in the peer interaction, body images, and that becomes a primary focus. The middle phase is 14 through 16 years of age, and this is where they're trying new roles, advancement in moral thinking, the focus on sexual identity and sex drive and things of that nature. And then when we're merging on or moving towards the late adolescent years of age, and that could be ages 17 to 21. This is where there's an increased depth of peer friendship, intimacy begins to forge, and there is some decreased influences as far as peer relationships. So Eric Erickson's psychological more random, this is where there's a gap between childhood security and adult autonomy. So when we're looking at these neurobiophysical factors, we can understand how these different factors impact the way we view life and the way teenagers specifically or youth encounter some of these different things and how trauma alter these situations. So neurologically, trauma impacts the brain structure, the functioning, and these specific regions are neural pathways. They involve our emotions, our cognitions, and our behavior. So trauma affects how the brain develops. Also affects how the stress responds and how our decision making, our impulse control system impact the reaction of teens. The biological factors, again, this is where the adolescent growth spurts occur. This is where brain development occurs. That could be nutrition, that could be also the development of the pubertal process. This is where you'll see those influences take part and take place. And these genetic predispositions interact with the environmental stressors to influence addiction and vulnerability. Again, those biological factors are so important. And as brain research has focused on childhood or early childhood in the past because it was believed that the brain had finished its development by puberty, most researchers now believe that myelinization, which is a process of neurons surrounding themselves by fatty coverings called the myelin sheath, continues to grow throughout the adolescent development or development years. So we can see these biological factors really have an effect on the overall development and how these environmental stressors can be influenced. So when we look at the psychosocial element, these are family dynamics, peer relationships, social supports that significantly impact outcomes. We can see that these functions can impede, or have an effect on those developmental skills. Like for instance, when we're looking at the cognitive development or information processing, how the informal operations such as abstract thinking, hypothetical reasoning, and how logic consistently develops over time, those things could be affected. In this element, also communications, attitudes, emotional regulations, identity formation can really have an effect on the development of a youth in those elements. And when we're looking at the social dimensions, these are where groups and families and conformities are made, adolescent developments or adolescent relationships are formed, peer relationships are formed, and those things that are affected could include gender, spirituality, um, identity, sexual identity issues, and those elements really affect how our teens are facing. So when we look at childhood trauma and what lies beyond the surface, we can picture how our children are um, traumatized for some of these things that we are dealing with. So let's take a look at Christopher. Christopher is a 17-year-old African American senior at RHS. He's a star athletic high school student, and he has average academic abilities. While socially, or he's sociable, he sometimes seeks attention through performative behaviors. So Christopher has a complex history, including experiences of sexual abuse during foster care before his adoption. He also lived with ADHD, which is attention deficit hyperactivity disorder, which contributes to impulsive tendencies, including engagement in risky activities such as promiscuous behaviors, suspected gang or drug-related activities, and drug sales. Recently, Christopher was injured in a gang-related altercation, which resulted in multiple fractures and a prolonged hospital stay. And this incident resulted in the loss of his sports eligibility and breakup with his girlfriend. He had declining grades and he had to forfeit his athletic scholarship prospects. So during his hospitalization, he also discovered that he had contracted an STD, and his girlfriend had undergone an abortion during this time period. Overwhelmed by these compounding challenges, he developed a deep sense of depression and he began to misuse prescription pain medication. So when you think about Christopher's situation, think about some of the complexities of his situation and some of the work environments that you are in. You may be a nurse at a hospital, or you may be a school social worker, or you may be a counselor at another agency that serves mental health populations, or you may be in the corrections facility working with youth who are detained, or those youth who are not in a secure facility. So, thinking about the complexities of Christopher's relationship, we're going to go into more detail of how his situation may be similar to the youth that you serve in your communities or sphere of influences. When we think again about what lies beyond the surfaces, especially for those who are considered adolescent or youth, these unseen consequences of adversity can be um, immensely shaped by a person's individual life and the things that they've gone through. And so when you think about what lies beyond the surfaces of those childhood traumas or traumatic experiences, mixed with those, what we will talk about a little bit later, as far as misuse and drug abuse, it can have a significant impact on a person's developmental function. It can impact a person's emotional dysregulations. It can challenge a person's relationship, and they can develop trust issues. They can have difficulty forming relationships and keeping or maintaining relationships. These things can affect their physical health issues, including chronic stress, that can lead to long-term physical health problems and increase risky behaviors. Traumas also can contribute to substance misuse, self-harm, or other risky components. Again, understanding the neuroscience regarding childhood trauma, it can really have an effect on how our brain architecture is functioning, and it can create lasting changes that can impact how a youth or adolescent process stress, how they make decisions, and again, how they regulate their emotions. So, this section, we're going to explore the intricate ways of early life adversities and how these things can reshape the developing brain and how it can impact stress responses, again, emotional regulation and decision making. In order for us to just kind of understand just the nature of how trauma affects us, we have to understand when we're in our perspective field as practitioners and how we deal with clients who have or may have experienced trauma in multiple ways. We have to be careful not to engage in harming the clients even further. That's through re-traumatization. So re-traumatization occurs when an individual re-experiences past traumatic events or reactivate traumatic relate or trauma-related symptoms in response to their current stressors or situations. And again, a person or a youth who experienced some kind of trauma may highly be distressed by the incident, and they may be experiencing some physiological, psychological, mental, emotional responses as a result from some of those different things that they may have experienced. So we have to be extremely careful not to re-traumatize the person, because understanding re-traumatization can be a critical part in the way that we provide trauma-informed care to help these individuals. So when we are shifting our focus and looking at some of the common misconceptions as we tie in or have these intersectional conversations about opioid misuse in particular for youth, what are some common misconceptions about opioid misuse that you all can think about and share in your experiences with working with the youth that you've shared? Can you indicate in the chat box what are some common misconceptions about opioid misuse? Hmm. Someone had said, I think it's important to acknowledge a lot of trauma responses are survival strategies that successfully have young people going through bad situations and are not only helpful in a new context. Yes. Peer pressure, absolutely. Another person has wrote prescribed pills as far as the misconceptions are safer than illicit drugs. Another person wrote, "It's a choice. It's not a big deal. It's harmless, in which it's not affecting others. It's only a phase." Absolutely. It's influenced by society. Yes. Another person wrote, "Is indicative of intentional misbehavior and is often the result of prescribed medications. They'll grow out of it. Everyone experiments with drug when they're young. It only happens to kids who do not have a familiar support." This is not true. Exactly. Another misconception is it's done in rebellion, not just a phase. Absolutely, absolutely. And going back to some of the misconceptions and dealing with the case scenario or the case study we talked about with Christopher, another person wrote that Christopher is dealing with diverse layers of traumatic experiences and ACEs. So the neurological pathways impact in biological experiences and influences and psychological, social relationship reasoning and emotional regulations can really influence the way we perceive and actually work with individuals who may be dealing with similar situations. These are some really good examples of some misconceptions about opioid misuse and use. Another misconception is it's okay if it's a prescription or to mask their emotional pain. Another person wrote, "People misbehave in certain ways because it's helped them survive different things in their lives. There was a reward and a behavior work for them for the way that they reasoned that they needed to do this. However, when circumstances change, behaviors also need to change. And we must also make the decision best for ourselves in given the information that we have. Sometimes we don't realize that we need more information to make the best decision. And this means making unhealthy choices because we don't realize any better." Those were some really good examples of some misconceptions about opioid misuse and how they can affect our youth. So when we think about what is opioids, opioids are natural, are synthetic chemicals that reduce feelings of pain. And some common prescriptions of opioids includes some of these that we have identified today. That could include hydrocodone, oxycontin, codeine, morphine, methadone, fentanyl. And so when we explore a little bit about some of these drugs, we can understand how the harm of these drugs can really affect our youth or our teens today. So some of the data that specifically has enhanced our understanding of substance abuse, specifically among high school students, we realize that substance abuse has decreased over time. However, um, adolescent use and related death shows that the signs of improvement has increased, so that their mental health information as well. So that's some promising information that will help us to understand that we are providing some information. We're getting more details. We're getting more resources out to help deal with these issues, but there's still work to be done. So when we look at, again, some intersections of trauma and opioid misuse, we understand the types of trauma that can affect a person's development and brain function and emotional regulation can lead to some maladaptive coping mechanisms. Again, that could be misusing drugs, that could be sexual promiscuity, that could be just other risky behaviors that can alter the way a person functions. So opioid misuse can tragically become a mean for a person to self-medicate when they feel overwhelmed with pain, when they feel an immense fear or dealing with anxiety or distress. And that could be dealing from or stemming from some unresolved traumatic experiences. So understanding these links are fundamental to providing prevention and intervention strategies that can help us relieve and deal with some of these things. And so as we move forward, linking some of the trauma to opioid misuse and addiction, some of these links can help us to understand that childhood trauma and experiences can can help us to understand why these things are linked and highly linked. So those experiences could include abuse, neglect, childhood household dysfunctions. Also, when we're thinking about survivors of trauma, sexual traumas, those survivors of sexual assault can be emotionally stressful or distressing, and that can lead to things like anxiety, depression, and even PTSD, which can also lead to substance abuse misuse as a coping skill or mechanism to deal with that pain. When we're dealing with people who have experienced combat trauma, those could be military personnel exposed to combat, and they can often deal with or develop symptoms of PTSD and other mental health challenges. And a lot of times with combat trauma, what we don't recognize that these youth and children may be experiencing some traumatic stress from their parents being deployed or their parents coming back from combat, and the changes that they are experiencing are the things that they are hearing about those traumatic experiences, especially through secondary traumatic experiences that they may experience. So also medical trauma can lead to experiencing, especially those who are experiencing severe pain, those who have endured invasive procedures, long hospitalization stays, and those things that can really hinder a person's ability to understand the link between opioid misuse and trauma. When we look at some of the natural categories of opioids, again, some of those categories can fall into different settings. That includes natural opioid use. Again, we had talked about some morphine and codeine. We have the semi-synthetic opioids, and that could be the Oxycontin, hydrocodone, hydromorphine, and things of that nature. Then the synthetic types, and that could include the methadone, and the synthetic opioids other than methadone could be tramadol and fentanyl. And heroin, which is an illicit drug, that could be made from morphine, that could be in a white or brown substance or black sticky substance. And two of the main ones that I want to focus on today that really gives us an idea of what we're dealing with is fentanyl and heroin use, especially among youth. So just going back to a little bit more statistical data, according to the CDC, 15% of high school students have either used illicit drugs or injected drugs. And that could be cocaine, inhalants, heroin, methamphetamines, and things of that nature. And 14% of students reported misusing prescription opioids. Whereas in 2023, approximately 69% of all overdose in deaths resolve in the use of synthetic opioids, and that could be primarily including fentanyl and fentanyl analogs. And that's why I wanted to spend a little bit more time to talk about some of these things that fentanyl has contributed to our youth and how it's directly affected our youth. And again, as I mentioned before, the link between trauma and opioid use can increase the rate of risky behaviors. And according to the Substance Use Among Youth survey, youth opioid use is directly linked to sexual risky behaviors, and also risky behaviors, including not using a condom, that can lead to HIV and STDs and unintended pregnancies. So going back to fentanyl and how it can be a devastating effect on our communities, not just our youth, but our communities at whole. So fentanyl, again, is a synthetic opioid used for pain. And again, it's so powerful, and it can be 100 up to 100 times stronger than morphine and 50 times more potent than heroin. It's undetectable, it can't be seen, tasted, smelled, but it's also, as far as doses, very, very lethal. And a shocking 40% of counterfeit pills tested by the DEA contain potentially lethal drugs of fentanyl. So we have to be extremely, extremely careful when we're thinking about our youth and the exposure that they have. And even a tiny dose of fentanyl can be impactful. And it only takes a small dose, maybe 2 milligrams to be lethal and often leading to deadly results. So this is a figure or a graph that gives us an idea of the adolescent overdose that has occurred, especially within since before the pandemic. And you see the dark blue indicates fentanyl use, opioids is the regular blue, and then the green is the non-opioid use. And while there has been an increase from 2% from 2022 to 2023, making small annual increases of fentanyl deaths, it's still vitally important that it is a death. And these deaths remain higher than the pre-pandemic levels, and the increase has slowed down from 2% in 2022 to 2023, respectively. So even though there is an increase between those years, we have to make sure that we're continuing our efforts to educate and advocate for these things to be made aware of to protect our youth. Other information or other figures shows us the fatalities involving fentanyl and how this increase has been faster among adolescents than adults in recent years. So we can look at the numbers and how the increase of other drug use overdose as far as that is concerned, and how the fentanyl overdose has is increasing. As you can see, in 2018, it was at 32% as far as fentanyl use, and it was 47 use with adults. In 2020, it was 65%. 2020, it was 62%, but in 2023, an astounding 70%, 76% fentanyl overdose usage in teens have significantly climbed versus 69% in adults. So this is very alarming. And so these deaths can just really attribute to the things that we know about and the ways that we continuously have to advocate and make this aware. Some ways that adolescents can obtain drugs, they can obtain them through social media, um, through contaminated reasons and purposes. And for time's sake, we're going to go ahead and continue to move forward. And again, this is just a percentage of co-occurring substances that may be useful among high school students who have reported drug use within the past 30 days. I'm going to go ahead and just move forward past this for time sakes. But what we can't understand, just the understanding the nature of the opioid crisis, the Center for Disease and Control and Prevention has noted the rise in opioid use, overdose death, and it shows in ways in how these has decreased from 2020, 22 to 2023. And we can see that there is a rise. And there are some things that we can do as far as understanding how the CDC's work has guided our just understanding of opioid use and misuse and the deaths that has occurred as a result, and what we can do to continue to fight for and advocate for these things. So the CDC is committed to fighting opioid overdose pandemic and supporting states as they continue to work to identify outbreaks, collect data, respond to overdose use, and provide care providers with the tools and the resources that they needed to be able to do so. So this figure or this image provides the guiding principles that CDC uses to prioritize what they're doing to promote health and equity, to partner with agencies that can provide evidence-based action and treatment, to drive these innovations in a way that's going to make sure that we're able to monitor, analyze, and communicate these different ways to help our youth. So just for time's sake, I'm not going to go ahead and do this, but just thinking about Christopher's situation and reflecting on our understanding of what we learned about evidence-based or learned about the epidemic that we're dealing with on a micro level practice, meso level, whether you're working with individuals and groups or whether you're working with communities on a macro level, how would you intervene on Christopher's behalf if you are working in your particular settings dealing with the complex issues that we've mentioned before regarding Christopher? I'm going to offer a moment for you to just quickly note some of the informations in the chat so that way we can move forward with understanding how these things can help us. And I definitely can see that some of you all had noted some of these um, different ways to adapt and how we can utilize this data to help us. So one person had put that she think adult access to fentanyl test strips is much higher than it is for youth, and that's probably a part from the statistical data. Wow, this is some great information that can help us just kind of intervene better and look at how we can help our youth to be able to deal with and address these issues. So, what can we do as far as interventions to support our children? First of all, I think that well informed is a way to be able to help us understand it and to be able to support our children. What can we do to support our children through informed care resources? We can create a safe place. If you are in your sphere of influences, whether you're in a clinic or whether you're in a school environment or whether you are in a facility that hosts or that secures youth, creating safety is such an important and an overwhelming part of how to intervene. Making sure that you're teaching them how to regulate their nervous system, being able to build strong connections in the community and within their peer influences, being able to support the development of their coherent narrative, allow them to share their stories and not be judgmental about some of the things that they've shared and some of their experiences, because just because a person or a youth is experiencing opioid misuse or even abuse to some extent, understanding the narrative of their stories is important to understand where they're coming from and how they may have experienced some of these childhood trauma and or experiences. Helping them build social and emotional resiliency skills and foster post-traumatic growth is super important to understanding these experiences and helping our youth. When we're understanding how to provide trauma-informed care, we need to understand that there are 4 R's in trauma-informed care. That could be recognizing or realizing the widespread of the impact of trauma and understanding the path, recognizing the signs and symptoms in traumas and families and friends, our families and staff, and others that are involved in the system, responding in a way that's going to be helpful, especially for our youth, and being fully integrated with knowledge about trauma and integrating that knowledge into our policies and procedures and practices. Again, wherever you are informed or wherever you're working with, making sure that your agency is fully responsive and informed relating trauma-informed care. And the fourth one is resisting re-traumatization, as I mentioned earlier. Re-traumatizing children can be a detriment on their healing and their growth process. And so we have to make sure that we're responding to ways that can help them. So being a trauma-informed organization requires us to be able to practice these things and just recognizing in ourselves also if we are experiencing some traumatic issues or events as a result. And for time's sake, I want to make sure that I'm highlighting some of these interventions that has been provided that includes information from the National Childhood Traumatic Stress Network. And these are some evidence-based interventions that you all as practitioners can be trained on and use as a way to help these youth that you are dealing with, especially if you're in a school setting or if you're in a clinical setting or even in a hospital setting. These are some interventions that's provided that can help you in various settings. Also, other evidence-based interventions could include things like circle of security, parent-child interaction therapy, the triple P parenting program, these and other things like trust-based relationship interventions, TBRI. Some of you may have heard some of these interventions that may be useful, and these are evidence-based interventions that can help children beyond the regular situations. And so these interventions will be helpful as well. And I will provide a screenshot or a slide, a PDF format with all of these resources that you all can have access to as well. And so, lastly, when we're thinking about how we can foster resiliency and uh, promote resiliency among vicarious traumatic experiences that you all have experiences as providers, we have to make sure that we're understanding what it is that we're experiencing as a practitioner. And they may range from a lot of adverse experiences like vicarious trauma or vicarious traumatization, secondary traumatic stress, and compassion fatigue. And for time's sake, I want to go ahead and make sure that we're covering some of these things that can help us to understand these things. So, secondary traumatic stress occurs when a professional considers themselves overwhelmed by their willingness to offer assistance and relief to those who are traumatized service users. And those consistent symptoms can mimic those of traumatic stress disorder. They could be unsettling nightmares, undesirable effects, intrusive thoughts, heightening irritability, and things of that nature. So, this illustration of the leaky bucket just gives us an idea of what that looks like. If we're constantly pouring into someone else and constantly listening to these traumatic experiences, we are, emptying ourselves and voiding ourselves of those things that can really help us to become the best practitioner that we can possibly become. So we have to make sure that our cup is refilled too in order to be of an assistance to the clients that we serve. So, some practitioner centered evidence based interventions and trauma informed strategies could be stress busters, including those ways to help us as mental health providers or clinicians to be able to do these things. And that could be getting support, being around people who understand our issues, the clients that we serve, accessing nature, being mindful, increasing our physical activity, making sure that we're having a balanced nutrition. Because if we're telling our clients to do these specific interventions, we have to do them ourselves to make sure that we're able to function as well. Because if we are experiencing secondary traumatic stress disorder, we're not well if we're experiencing those things. So we have to do things intentionally to provide for ourselves. So these are some common toolkits that can be used as resources to help us not only provide trauma-informed care and resources to the youth that we serve, but some services and interventions and toolkits that can be helpful for us to be able to take care of ourselves as well. And that's included the National Society of Traumatic Stress Studies, Office for Victims in Crime, and the SAMHSA website. So, how can we understand the nature of trauma, role in opioid misuse among youth? We can advocate for change, changing our narrative of our understanding, advocate for the approach that we use to deal with childhood trauma and opioid misuse, and advocate to change the way we care and seek support to deal with these matters concerning childhood trauma and opioid misuse among youth. These are some additional resources that may be helpful for you to explore to be able to enhance your ability to care for these youth and to just inform your agencies as well. And I know that we have just a few more moments, so I'm going to make sure that I leave room for questions and answers. And I will open up the chat if anybody have any questions that they would like to ask before we conclude our session.
We do have a question. Can you please clarify the difference between re-traumatization and being triggered?
Okay, that's a great question. So, re-traumatization can be a person's ability to uh, experience the traumatic event as if it just occurred and if it just happened, and experience those traumatic symptoms um, again as it occurred. And when you think about triggers, those can be those emotional, psychological, and physical responses as well. So they can be aligned or semi or parallel, but what the difference is re-traumatization um, can heighten our abilities to really feel those emotions in a greater level.
Well, thank you so much for being here, Professor Specks. We truly appreciate it. Thank you to Northeast and Acadian area for partnering with us to host these free webinars. I know it's a great resources for all our Louisiana healthcare providers. But everyone have a great rest of the day, and thank you all so much for being here with us.